can still say good morning, so good morning, everyone. I really appreciate the opportunity that Smoke Free SC has given me to speak with all of you today. There are lots of familiar faces in the room and also lots of new ones, and that's encouraging, especially in kind of the state of the state and the state of the country, what's happening right now. I think one of the things I need to follow up with Rajiv, responding to that last question, is that the ATS and YTS information should be available now on our Department of Public Health website. So if you go to our website, that information is available. If you have any questions, don't ask me, ask Rajiv. So I'm Hellen Dekle, and I'm the Secondhand Smoke and Vaping Protection Manager for the Department of Public Health, and we are now a tobacco prevention and cessation unit. As all of you know, we were DHEC, as Andrew had mentioned earlier, when he was just a very young, just out of high school student, I think. He hadn't even gone to college yet. So it's been many years, and it's exciting to hear from him and all of his research. So I've got some notes. I'm trying not to miss anything. Whenever we talk about cessation, which is your main focus today, we also need to and should always talk about smoke-free, vape-free, and tobacco-free policies, because the two go hand in hand. When you have cessation and you have tobacco-free policies or the smoke-free policies in a variety of settings, we know that these big P policies, especially ordinances, are incentives for people to quit. We are trying to regulate where people are exposed to secondhand smoke, and of course now as well vaping aerosols or vaping aerosol toxins. I'll use that interchangeably today. It's also one of our main objectives for our unit, the work we do in the state, and also for our state tobacco plan, which is a plan for all the partners in the state, not just the Department of Public Health. What you're seeing right now is our updated map. I'm so excited to share this with all of you because currently we are at 71 total ordinances to include cities, towns, and counties. And that's not just because of the Department of Health infrastructure and funding. It's because of all of you. Some people, some of our partners are not in the room today, but it's because of your efforts. None of this could be accomplished without partnerships and collaboration. So thank you to all of you. I also want to draw your attention, and you should have the map in your folder so you can see it a little bit closer. I want to draw your attention to the fact, the note at the bottom of the front page, where it says that as of December 1st, 2024, that 61% of South Carolinians in cities and towns are protected by smoke-free workplace ordinances, and that 37% of the population is protected in counties. This is a significant increase from just 3 years ago. Our statewide partners, to also include Cancer, Heart, and Lung, I know Kelly is here somewhere, I heard her earlier, that they decided that we really wanted to make these efforts to be across the state. We do have a statewide law, a clean indoor air law from the 1990s, but it is very weak. It is full of loopholes, and it does not address all workplaces. The significance of these ordinances that have been passed at the local level, municipality by municipality, is that they are mostly comprehensive, that they include, some include the newer ones, e-cigarettes, and that it's for all public places, workplaces that have public access. So please understand that. The other note that I want to draw your attention to is that we have switched up the map just a little bit. If you flip over to the back side, it used to be that the ordinances were listed in alphabetical order. Well, that's wonderful if you want to look it up that way, alphabetically, you know what town or city you're looking for, but it didn't truly relate to the visualization of the map, this snapshot of our progress and our impact in the communities. This suggestion came from one of my community partners over on the side of the room, and she said, well, that doesn't really relate to each other. How are we supposed to look this up if we have not memorized what cities and towns are in what counties? And I thought, wow, that really makes sense. We hadn't thought of that. So we have changed that most recently, so it now is a better reflection and it's a better understanding with the public. I think one of the questions was, well, if you have this data, how are you sharing it? What we do is super important. It's protections in place. It's helping people to not be exposed to secondhand smoke and vaping toxins. And we need the public to understand this. So the data that we collect must be shared, and it must be shared in a very user-friendly format. I think one of the other presenters had also mentioned about support and perceptions about smoke-free. How do we know that the public supports this? Andrew said when he did his study in Columbia for the Make It Happen Columbia campaign, smoke-free campaign, that they said this is never going to happen. Well, we have proof here that it has happened, and it's happened in 71 places, so we're super proud of this. We also know that through many of our community partners who are conducting a very simple, I think it's 6 questions, brief survey, asking about whether people in the public believe that secondhand smoke is harmful, e-cigarettes are harmful, whether they frequent places of business that are smoking, allow smoking and vaping, or they don't, and also do they support Big P policy, which is community-wide ordinances, so we call that Big P as opposed to Little P. Big P policy ordinances, do they support them? And the results are overwhelming. From the coalitions and the groups and the contractual partners around the state who are conducting this survey, I would say just off the top of my head, don't hold me to this, but I can send you the results later, but off the top of my head that it's overwhelmingly about 90% or more that say secondhand smoke, they know it's harmful. E-cigarette toxins are harmful, that they do not frequent places that allow smoking, only smoke-free, and they would certainly support ordinances in place for all workplaces to be smoke-free. Our last 3, continue to look at the map. Let's see if I have my pointer in here. Okay, I'm trying to be all fancy. In, I think it's Williamsburg County, and then also in Orangeburg, our last 3 ordinances that were passed just this past year, 2024, were Vance, Livingston, and Lane, South Carolina. Now, some may say, well, we know those are super small little towns, so does that really have a great impact? It gets us in the direction that we want to go, called progress. It protects individuals in those communities, in the workplace and the public place. So at this time, I'm going to ask that if the Hold Out the Lifeline staff who are here today, one of our community partners, if they will stand, and let's give them some applause for their efforts. They are the folks who actually recruit, educate, and train local, what I call real individuals who are not with state agencies or other organizations, real people who live and work in these communities. They educate them and train them to have a voice. They give them talking points and other tools. They give them this map so that they can then go to decision makers, which is generally city and county council members, to say, this is what we support, this is what we want, this is what we need, this is what we demand. And they've been successful. So thank you again to Hold Out the Lifeline and all the other partners. I'm going to switch gears just a little bit, and I want to talk about the infographics that are also in your folder. So big sheets. Thank you to Smoke Free SC for printing these for us. We're a little bit behind right now with our DPH restructuring and also moving for our printing, so we do appreciate Smoke Free SC for doing that today. And she just told me I have 2 minutes. Okay, I'm going to talk really quickly. So we know what we're doing and where we're doing it in the state, but why is it important? What is the overall impact? What's that return on investment? Why is that important? We are very lucky to have a contractual collaboration with the University of South Carolina Arnold School of Public Health, Reston Hartzell and Dr. Tony Alberg. They had worked on a study for us which was secondhand smoke, really death and disease related to secondhand smoke exposure. I had been asking for this for years. We had always had the smoking-related death and disease, mortality, morbidity, but we didn't have secondhand smoke. And I wanted to be able to prove that there was a return on investment and that we are making great impact. And now we have the information. If you'll turn your attention to just the secondhand smoke exposure, the first one, important cause of death in South Carolina, you can see the overall death rates. You can also see by county. The bottom line here is really your conclusion that there are 371 deaths per year in South Carolina, but please note they were really only looking at several risk factors of cancer, heart disease, and stroke. Tobacco use, secondhand smoke exposure, is a risk factor for so many other diseases, but this was just focusing on the three. So somebody say, well, that's an insignificant number, it's a small number. This number represents people. Who could be your brother, your sister, your cousin, your neighbor, your loved one, whoever it may be, but these are people. And this is really only looking at three conditions. The other piece of this is that we know from this study and the data results that in the smoke-free counties that were shown, having ordinances in place, those protections in place, those diseases and illnesses were significantly lowered. So they really looked at pre-ordinance data and post-ordinance data, and there's a direct relationship or linkage to having a protection in place community-wide that then drives down death and disease for our populations. So at what cost? So if you look at the second sheet, I know she's going to tell me I have 30 seconds. It's really about the economic cost, because a lot of times when we talk to decision makers and even our own leadership, they want to know what's the bottom line, what's the money, what's it going to cost us, what's the burden, what are the economics. You know, we talk about saving lives, but sometimes that's not enough information. So we want it to be twofold. We want to talk about the economic burden to the state. So again, looking at lung cancer, stroke, and heart disease only. Medical care costs, $2.7 million, $24.4 million, $237.1 million, and million is correct, so a total of $264 million, and that's deaths caused by secondhand smoke exposure and treating those patients from disease. Then if you look at disability and premature mortality, it's talking about the years of life lost, and you can see that in the chart. So if you look at the cost of disability and the medical care costs for treatment, again, secondhand smoke related, we're at a grand total of $690 million, and that's per year. Every single year costing the state $690 million. So please know that the smoke-free policies, smoke-free ordinances for public places is critical and vital to our health. It is critical and vital to our communities, our adults, and our youth, and that everything that you do that is policy related, we greatly appreciate, and those efforts need to continue. Thank you.
My name is Sedergren. I am with South Carolina Department of Public Health. I want to thank Smoke Free SC for asking me to present today. I'm going to be very brief, especially since Lorenzo covered some of my stuff, so we can just really fly through some of these. So South Carolina Tobacco Quitline, we have established what it is, what we offer. It was established in 2006. We're open 24/7, year-round, serving everyone 13 and up. I want to highlight on our logo right here, Quit Now, never mind, I'm not going to highlight that. QuitNowSC.org is our website, and we have several trainings. Some questions have come up about BTI training. We have 2As plus Rs. We have specialized trainings. And then, of course, our excellent health systems optimization team can come out in person. But our website is an excellent resource if you want to just find any information about how to convince a loved one to enroll, if you need to enroll. Excellent resources for providers. So just going to hit that quickly. So I don't think I really need to touch on too much why the Quitline is needed. I think we're all pretty well versed in why we're here and why it's important. But there are some startling statistics still in place despite the great work that we've done. So as of 2023, nearly 1 in 8 adults were current smokers, and 650 youth start smoking each year. in the state of South Carolina. South Carolina ranks 25th in the nation for smoking prevalence and is actually the 8th most expensive state for the average smoker, costing the average smoker more than $2.3 million over their lifetime, or $48,962 each year, which incidentally is more than the mean per capita income for the average South Carolinian. Back to why the Quitline's needed, we also know that commercial tobacco users are 60% more likely to successfully quit when using Quitline services as opposed to trying to quit on their own. We've covered Quitline programs, so we're not going to hang out here. All right, so who actually uses the Quitline in South Carolina? So all of this data I'm going to show you on the next few slides is from July of 2023 to June of 2024, okay? So it sits on that fiscal year. So we had 7,851 enrollments in the Quitline. Of those, 5,160 enrolled in our standard care program, 2,434 enrolled in our behavioral health program. We had 111 enroll in the American Indian program, the same number in our pregnancy postpartum program, and 38 youth were enrolled in our youth program, which is separate from Live Vape Free. If anybody has questions about numbers, about any of that, or the differences, you can ask me, Lorenzo, Logan, Amanda. So there's kind of a lot here, but the point of this slide is that the Quitline serves some of the most vulnerable people in South Carolina. We serve everyone, but when you really look at who's using our services, who's really in need of our services, it's truly the most vulnerable in the state. So 21% of enrollees for this time period did not have a high school diploma. 81% were over the age of 40, and actually 41% were between the ages of 41 and 60. 44% were Medicaid insured or uninsured. More than half, 54%, live with a chronic condition. COPD was the most common condition reported, with almost 1 in 4 reporting living with COPD. Almost half live with at least one behavioral health condition. And although we've talked a little bit about the rise of vaping and Zins and the non-traditional tobacco use methods, 95% of our enrollees were still looking for help to quit cigarettes. So that's still a big part of what we serve. And somebody asked a question about referrals. So 42% of our enrollees in that year learned about the Quitline through a health professional. And I want to pause really quickly. It doesn't have to be a traditional health professional. We'll accept referrals from anybody. Referrals are a huge part of what we do, a huge part of integrating the Quitline into, as Sharon mentioned, into the healthcare system, into the provider's daily work. And we've seen that grow tremendously. If anybody's interested in referral data, my contact information will be up here on the last slide, and I'm happy to share. So this, oh, you can see it. Okay. So the Quitline has served over 250,000 South Carolinians in its nearly 20 years of operation. This map shows the sort of prevalence, or I guess, the number of South Carolinians by county who enrolled in the Quitline. So you will see the counties with the most Quitline enrollments, those are the dark red. Hopefully you can see that okay, but they were Horry, Greenville, and Spartanburg, and Spartanburg wins the award for this time period. They had 762 enrollments from that county. So I show this to not only just kind of give you a heat map of what it looks like, but also to kind of give you an idea of the level of data that the Quitline can provide. We are happy to share this information to help your local efforts, your regional efforts, community-based efforts. If you think something would be helpful, if there's a question you have, I can almost guarantee you that the Quitline has. We have the information, we have the data, and I can get that to you in whatever format makes the most sense. So briefly going to touch on South Carolina Quitline impact and return on investment. These seem to be hot words lately with the new administration. So at 40%, the Quitline has one of the highest quit rates in the nation. We measure this at 7 months post-enrollment. And quit rate is defined as having been quit or abstinent for the past 30 days at that 7-month follow-up. Just in case anybody's curious, the national standard, the gold standard, is to be at 30% or higher. So South Carolina is doing great at 40. The Quitline saves $1.79 in healthcare expenditures, lost productivity, and other costs for every $1 spent on the Quitline and cessation media. And with a $3 million taxpayer investment, the Quitline's annual return on investment is $5.37 million. To date, 106,000 premature deaths have been averted, 33,496 lives saved from cancer, and 38,160 lives saved from heart disease from those who use the Quitline to quit smoking. I love data, so I'm glad I got to talk about data, and but sometimes words just mean a lot, and it's really nice to see the personal impact and how the Quitline helps save lives, change lives, and improve the health of others. So I wanted to close with just a couple of comments. These are actually very recent comments that the Quitline received. You guys helped me stop smoking. I tried so many times and couldn't do it. Thank you. I would not have been able to do this on my own. My coach was always there to help me, and I feel much better smoke-free. You guys can read these, but I just find these words so impactful, and I look forward to getting these reports when we get them from our vendor, just kind of showing the positive feedback that the Quitline receives, and just being reminded that we truly, truly are making a difference in helping others. Here's my contact information. So again, if anybody needs any data, come find me. If you're interested, if you have questions about anything the Quitline does, how it works, how you can promote it in your community, I'm right over there.